Let me begin with a quote made by a Republican candidate for president, a candidate who reached out to working people and who reached out to senior citizens. And during the campaign, this is what that Republican candidate said. He said, "I am not going to cut Social Security like every other Republican, and I'm not going to cut Medicare or Medicaid. Every other Republican is going to cut them. And Trump, we are going to hold you accountable." You told the seniors of this country you were on their side. You told working people you were on their side. You said you would not cut Social Security. You would not cut Medicare. You would not cut Medicaid. You know what? Millions of us are going to demand that you keep your promise. And we're going to tell the Republican leadership in the House, we're going to tell the Republican leadership in the Senate, forget about all of your plans to voucherize Medicare, to raise the retirement age for Social Security, to slash Medicaid. It ain't going to happen. And what we are going to do are rally millions and millions of working people for whom Social Security, Medicare, and Medicaid is life and death. Let us be very clear. We live in a nation which has more income and wealth inequality than any other major country on earth. We live in a nation where 43 million people are living in poverty. We live in a nation, believe it or not, where half of older workers between 55 and 64 have nothing in the bank. And we are not going to allow the billionaire class or Trump or anybody else to cut the programs that the elderly, the disabled vets absolutely depend upon. As Nancy said, we understand that millions of seniors cannot make it on $10,000, $11,000, $12,000 a year Social Security. Our job is to expand Social Security, not cut it. And we understand that despite Medicare today, millions of seniors still struggle with health care bills. Our job is to improve Medicare, not to cut it. Now, on all of these issues, it's not just us who believe that we've got to protect these vitally important programs. Every poll out there says that the American people are with us. And that is why the leadership of the Republican Party in the House and the Senate and Mr. Trump have got to start listening to the American people, not the drug companies, not the insurance companies, not the billionaire class. If we stand together and fight back, we are going to win this, and that is exactly what we have to do. In this country, we pay by far the highest prices in the world for prescription drugs. And to quote Donald Trump again during the campaign, he said, "Wouldn't it be a good idea if Medicare negotiated prices with the pharmaceutical industry?" We're going to hold them accountable for that. And I live 50 miles away from Canada. Many of the same prescription drugs are sold for 50% of the price. We are going to bring forth reimportation. Trump mentioned that. So to pick up on Senator Schumer's point, we want to expand Social Security. We want to take on the pharmaceutical industry whose greed is hurting millions of Americans, lower the cost of prescription drugs. You know, that's a very good question. The question is, who's going to pay for it? Right now, top 0.1% has almost as much wealth as the bottom 90%. In the last 16 years, we have seen a tenfold increase in the number of billionaires in America. Today, despite Americans working longer hours for lower wages, 52% of all new income goes to the top 1%. Have I kind of answered your question? The people who are going to pay for an expansion of Medicaid is lifting the cap on taxable income, all right? And when you do that, you do two things. We can extend the life of Social Security and Medicare, and we can also expand the program. So in the midst of massive income and wealth inequality, of course, the top 1% is going to have to start paying their fair share.